Hey there, I'm Chip over with Total Motion Physical Therapy. Obviously you're on this webpage because you're curious about what can be done for neck pain, neck issues, maybe headaches, stiffness, difficulty driving and things like that. So have you ever had a situation where you're having a hard time checking those blind spots, or maybe you get pressure in one of these spots that maybe a lot of it seems to even stem from tension that maybe starts in my upper neck too, that kind of feels stiff, for example? So if that's the case, you might wonder, is physical therapy a tool that could potentially be helpful for us? We've got this kind of brief little screen. You'll describe in all the information that we've given out to you. I think it kind of lets you know if this is something that might potentially work for you. So once you kind of do these things with me. So if you just start off just by looking down. As you do each of these things, you might even grab a little extra hands to help out with that too. You might want to think about where do I feel a stretch, a pull, a strain, and things like that. Now you can look up. Good. Now you can turn your head from side to side. And I'm comparing how this feels for me to do these things as I do it. Am I enjoying this? Does it feel like my range of motion goes pretty good on these, or do I feel restricted if I had one, and so forth? Because neck problems are actually very specific things that have a lot of potential symptoms and problems that can tie into that neck. I think of the head as kind of like at the top of a giant skyscraper, where there's all kind of injuries even below it that if anything in that system's thrown off, it can kind of mess with the neck itself. Now that can get pretty complicated because there's 206 bones in the body, over 500 muscles in the body. A whole variety of things could cause a neck to mess up just because of its position unique to on top of the rest of it here. But let me give you a little hint here. So first of all, if I went through that screen, if you had a lot of problem with a looking up test in particular, or if you wanted to even add a variation of that, if you did up and then kind of tilted a little left and right, and that was kind of interesting, and that was one of your tougher tests, you might potentially be looking at either an arthritic type of neck, or if you're maybe in the younger category and you're hitting that, it might be more of a nerve compression, maybe a disc type of problem on those things. If you're a little older, in addition to arthritic things, it might be something we call stenosis, where the nerve can get compressed that way. If you have that problem as your number one, again, that would be a good physical therapy patient. There's some things specifically unique we do with those type of patients. Now, if you had a problem more so going from side to side on any of those kind of tests, in particular, if you notice that one side was more restricted or strained or painful than the other side, that often is going to tie into things that tie to the rest of the body, like I was saying. Maybe there was an injured chest or shoulder over here that pulls on that neck and is creating that jam. Or maybe there's something even down in the hip that gets thrown off that could maybe even mess with the neck as well. That again is something that I would definitely recommend going to see a trained specialist who knows how to look at the whole body and the whole system as part of the neck. That's where I would go if I saw that symptom. The other one, let's say you thought your range of motion was actually pretty full, but at the same time you're having neck and headache issues. Well, if that's the case, if it is again a physical therapy type of issue, almost always you're going to see that tension really doesn't start as a neck problem. It really again starts as something else in the system. Again, like I said, just pulling on it like we did some other things there. So again, you have to have someone who can screen that system pretty well and knows what they're looking for. So if you've said yes to any one of those three categories I just said there, you might potentially be a good candidate for therapy. So what I would recommend to you, I'm going to give you a couple different options here. One of which, if you would like more information, you can fill out that data on that questions right below that for me to send information to you. I would also say you can feel free, obviously, on the rest of the web page. I'm going to give you other videos and links to other types of things if you want to know more information about us or other type of things. Certainly that's there. Also, if you have specific questions you'd like to ask, you can also again fill out there's a spot on that web page where you can fill out those questions. And one of our lead physical therapists, whether myself or somebody else, will respond back to you as quick as we can, trying to do within 24 hours the answer to your question. If, however, you're saying, I just want to go ahead and prescribe myself and go ahead and schedule for therapy, well, again, look on just below this page here. I'm going to give you my phone number and ways you can contact us to set that up. We're right here off Wake Forest Road here in Raleigh, North Carolina, and we would love to see you.